demonstrate CPR techniques tailored for infants under 12 months, with separate instructions for children over 1 year old as we go along. Remember the acronym DRS ABCD. Before giving CPR, we need to ensure both your infants and your own safety by ensuring a safe environment. Next, check for responsiveness. Shout to get the infant's attention. If the baby does not respond, tap the bottom of their foot and shout again while checking for breathing. Check for no more than 10 seconds. If there is no response, shout for help and get someone to call 999. But if you're alone, begin CPR immediately. Place the infant on their back on a firm, flat surface and assess as following. A. Airway. Examine your infant's airway using the head tilt chin lift method. Gently place your palm on their forehead to tilt it downward and use your other hand to lift the chin. Pick out any visible obstructions in the mouth, but do not attempt to insert fingers if no blockage is visible. B is for breathing. Position your cheek close to their nose and mouth to observe chest movement and feel for their breath on your cheek. If your infant is breathing, place them in a recovery position. But if your infant is not breathing, deliver 5 rescue breaths into your infant's mouth. To do so, seal their mouth and nose with your mouth, taking a deep breath and deliver each breath for 1 second. Check for rising chest movement indicating effective airway entry. C is for circulation. Check your infant's pulse for 5 seconds but not more than 10 seconds. You can place your fingers on their arm or over their groin. If you are unable to feel a pulse, initiate chest compression. Using 2 fingers, compress the sternum area of your infant's chest. For children over 1 year old, use your palm, considering the child's size. If one palm does not provide sufficient force, interlock your fingers to perform chest compressions for a bigger child. To get the correct rate for chest compression, follow the tempo of Staying Alive by Bee Gees or Pink Fong's Baby Shark, and you will achieve a chest compression rate between 100 to 120 beats per minute. A full CPR cycle comprises of 30 chest compressions and 2 rounds of breaths. If you are alone and have yet to call 999, repeat the sets of 30 chest compressions and 2 breaths for a total of 5 sets. Now, phone 999 and put them on speaker. Reassess your infant, check for breathing and feel for a pulse. If breathing is normal and you are able to feel a pulse, put your infant in recovery position. But if no breathing or pulse is felt, continue CPR until 1. The infant shows signs of life, 2. Qualified help arrives to take over CPR, or 3. You become exhausted. Children and infants often have respiratory arrest, while adults usually have cardiac arrest. Although rare, sudden cardiac arrest or SCA can affect children and infants. Automated external defibrillators or AED are portable devices that can save lives by restoring normal heart rhythms. They are safe to be used for children, making prompt CPR and AED use crucial for treating child and infant sudden cardiac arrest.